Welcome to #Wednesdays Weekly, a weekly information session in collaboration with the voluntary sector and public sector partners. Today's session is Changes to Health System in Rochdale, Children and Young People and Greater Manchester Integrated Care System. And our host is Charlotte. Over to you, Charlotte.
Thanks, Laura. So we thought it would be timely for me to come and speak with voluntary sector partners today, as the CCG in Rochdale and across the country, CCGs will be closing down from tomorrow. So from the end of June, CCGs will no longer exist and they will be replaced by one Greater Manchester Integrated Care System. So I thought it important to come and speak with people around those changes and what that means for us in Rochdale. Now, I don't have all the answers and we are kind of working our way through it, but I thought it might be helpful for me to just explain what I do know so far and talk about some of the things that we're trying to do to make it right for Rochdale and secure what we've got already. So I have prepared some slides. I'll just get them, just 1 minute, sorry. Now I have got a little video clip and I'm not sure if it will work, but I'll try. So my role, I'm the head of commissioning for children and maternity in Rochdale, and I commission and oversee services across health and the local authority. And I also have a team of commissioners that work with me. So some of you may have been in touch with Rachel McDonald or Janice Hollis or Sarah Tong. So we work together to secure services for children in Rochdale. So the Health and Care Act was introduced this year, and it means that we will move to integrated care systems and integrated, sorry, I'm just gonna pretend. Sorry, they're having too much fun around me here. Integrated care systems will bring together health and care organisations in different ways, and they will change our relationship with providers. So CCGs currently commission providers. So we work with Northern Care Alliance and Pennine Care for Rochdale, as well as some of the tertiary centres in Greater Manchester. But this will change. So GM will commission the provider collaborative. So we'll have one big contract with NCA or with Pennine Care to deliver our health services. So this little clip explains, I'm going to try to play it for you. You might need to give me a nod if it's playing.
I think you need to stop sharing your presentation and go on to the reshare the YouTube. Yeah.
Right. Let me try that then. Sorry. I don't know how to do it. Do you?
Want me to have a go?
Yeah, please. Sorry, I don't know how to.
Do you want to stop sharing? I think you're still sharing.
Charlotte, if you can stop sharing. Oh, that's it.
Can you hear it, or is it just me?
No, I can't hear it. Let me just
yeah.
Big changes are taking place across the health and care system. What does this mean for the organisations that make up the NHS? How will they collaborate with other parts of the system? And what will these changes mean for you and me? When the NHS was set up, it focused on treating single conditions or illnesses. Since then, our health and care needs have changed. more of us are living longer, and many have multiple conditions that require regular, ongoing care. However, this hasn't been reflected in the NHS's structure, a patchwork of organisations that often work independently from one another. Navigating this can be confusing and can have a negative impact on our experience of care. So, for some years now, health and care staff and leaders have been working to bring organisations closer together to better meet our needs by working in a joined-up way. Primary and secondary care, social care, mental health, and community health services have been seeking to partner with each other in different ways. At a very local level, GP surgeries have been coming together to form primary care networks, groups of practices working together across areas called neighbourhoods. By sharing resources and working closely together with other local people and services, they can provide a wider range of services than a single GP surgery. Health and care organisations have also been working together across larger areas called places, often covering the same area as a local authority, where large parts of the NHS budget are spent. Here, local government, charities, residents, and NHS partners can work together to understand and meet local health needs. But previous laws have prevented services becoming even more joined up. The 2022 Health and Care Act aims to change this and make it easier for organisations to work together. But what do these changes look like? Organisations are now coming together across even larger areas to form integrated care systems, partnerships of health and care organisations that plan and pay for health and care services. There are around 40 integrated care systems across England, and although they've existed for some time, the Health and Care Act gives them legal status, as well as new powers and responsibilities. Integrated care systems are made up of two parts: integrated care boards and integrated care partnerships. Integrated care boards decide how the NHS budget for their area is spent and develop a plan to improve people's health, deliver higher quality care, and better value for money. Integrated care partnerships bring the NHS together with other key partners, like local authorities, to develop a strategy to enable the integrated care system to improve health and well-being in its area. NHS trusts are also coming together to form provider collaboratives, new partnerships that can bring together providers such as hospitals, mental health services, and community services. So how are these new structures funded? Integrated care systems get most of their money from NHS England, which is the national body for the NHS in England, and sets the operational priorities for the health system. It's responsible for the health services you and I access day to day, which are inspected and regulated by the Independent Care Quality Commission. The Department of Health and Social Care sets out what the NHS is expected to deliver for the money it gets from the government, which comes from our taxes. It also holds budgets for some of the other areas that have an impact on our well-being, like public health. Throughout these new structures, local authorities play a key role. They receive money locally and from national government, which goes towards funding a range of services that support our well-being and prevent ill health. So, what does this all mean in practice? The Health and Care Act has put in place a legal framework that enables services to work more closely together, so it's easier for you and I to receive the care we need, when and where we need it. For these changes to succeed, staff and local leaders will have to work with one another differently, alongside key partners in local government, the voluntary sector, and communities themselves. Of course, services face other challenges like workforce shortages, growing waiting lists, and the impact of the COVID-19 pandemic. While the new structures won't fix all these issues, by enabling services to work more closely together and join up services for patients, it's hoped that the health and care system will be better able to meet our changing health and care needs in the future. Find out more about how the health and care system is changing at www.kingsfund.org.uk/explain.
Okay. So I thought that might be helpful just to explain better than I can what's taking place. I'll just continue to share my presentation. Okay, so this diagram here explains what's just been described in picture form. So the system is GM, the place for us is Rochdale, and then we're talking about neighbourhoods as well. So when we're planning now with regards to our services, we will be required to plan some things for Greater Manchester, so Greater Manchester wide. And I know that some of our voluntary sector partners have begun to have conversations at a GM level around specific delivery models. At Place, we do commission quite a lot of VCSE organisations, but we might need to think differently about how we sustain some of that and how we work together more moving forward. And what could we draw upon, I guess, from yourselves to develop our place, but also our neighbourhoods. And I'm going to talk a little bit about some of the projects that we've got going on in neighbourhoods in a minute. So in addition to the Health and Care Act, there was a welcome amendment that was added earlier on this year. And the amendment placed key priorities around an ICS, so the GM responsibilities around how they're going to continue to support children and their families. So their priorities were the following areas. So the amendment to the Health and Care Bill said that we need children's leadership at GM, which is welcome, and that we need to invest in prevention and early intervention. We need to support children who have experienced care and care leavers. There needs to be parity of esteem between physical and mental health. That we must engage with parents and carers and listen to them in planning of our health and care provision. That local systems must consider how services meet the needs of parents. So, for example, we're only going to meet the needs of a child if we support the parents' needs as well. So if you've got a parent that's got substance misuse issues or domestic abuse, for example, that's going to have a knock-on effect on the well-being of that child. That there should be more opportunities for partnership working and integration. And that where children need specialist health services, these might be provided on a GM footprint. We do have some questions, and these are some common national themes that are coming through. So there isn't really that understanding yet around the relationship between place-based activities and the ICS system-based activities, and some of this is going to need working through. There are some concerns around how this will change our collaborative working with key partners and how those partners have been involved in the ICS, and there's some challenges around, I guess, how are we going to, so if we're going to work on a GM footprint, a place-based footprint and a neighbourhood footprint, how are we going to spread our capacity within children's commissioning? And now I'm trying to work that through with my team and with senior leaders at the minute. So for us, we are looking at neighbourhoods and growing from the neighbourhood up the services that are going to meet the needs of our children and families. And a neighbourhood should cover 30,000 to 50,000 people, and it will include things like a GP footprint, the Healthy Child programme, so our school nursing, health visiting, support for children with SEND and mental health in schools. In Rochdale, we're going further. We have collaborations with the Inclusion Board, the Pioneers Trust, which is all the secondary schools, and RAF, which is the Federation of Primary Heads. So we are working very closely with our head teachers to understand what does that need to look like for our children's services and how does that wrap around a place. So what are the assets within our place that we could draw upon? So some emerging projects that you might be interested in working with us are as follows. We've begun to look at our system partners, and VCSE is absolutely key to that. And importantly as well, the changes in the Health and Care Bill place VCSE organisations paramount to the changes that are taking place, and VCSE will continue to have a significant role in supporting the health and well-being of our communities. For me, our voluntary sector partners are key to transformation. You have innovation and integration opportunities that we can't deliver within statutory services. And I know some of you are doing such fantastic work on the ground, but we don't always know about it and we don't always join that up. So what we need to do is deliver services that are more joined up We also need together and to work with you on hearing the views of our different communities across systems. So how are they feeding into you? How are we responding to that feedback, and how are we commissioning to respond? We've all got expertise, and we need to share that expertise across the footprints. So, but it's around the flexibility to deliver innovation and to utilise what you've got in the VCSE as assets within our new health and care system and economy. And it's around the credibility and trust. Some of you have more credibility and trust with our populations than we will ever have. So it's around us working together to meet the needs of our children and families, looking at non-medical models of care and joining up our services wherever we can. So some examples of things that we are doing. We have been successful as one of, I think it's 72 areas across the country to be a family hub area. And a colleague of mine, Amanda Highland-Partington, is working on developing family hubs across the borough. Now, this absolutely needs a VCSE voice. So I'd be interested in hearing from you in terms of neighbourhoods. What do you think are core ingredients of family hubs networks should be? And I'd like to, I guess, invite you to further conversations around this and more focus. We can come to the questions at the end. In Rochdale, what's important to us? So VCSE are recognised as equal partners to supporting the needs of our children. You have got an ability to influence and shape and co-design the services and our resources. So I guess the question back to you would be, are you involved in the development of those neighbourhood constructs, or how could we further engage you in the development of those constructs, particularly with a view to children and families? We know that we have got something special in Rochdale. We do work together, and I think that's around our connection to place. You know, we are from the founders of the cooperative movement, so in our blood, it's there that we work together. We have value-based discussions here that I've never heard in other places, and we solve problems together. So in challenging times, we work together to do what needs to be done, to have those informal conversations. Sometimes we are co-terminosity is supported. We do work together. We've got our Riverside building, but other times we need to kind of come together with some facilitation to identify what needs to change. So the other work that's going on in Rochdale, we've done our SEND Alliance. We have a vision for children with SEND in Rochdale. We have 7 joint outcomes, and we want to achieve the best possible outcomes for our children and families. And I'd like to engage the voluntary sector more in this area of work as well. We have got another session with some of our commission services on, I think it's Thursday, I think it's tomorrow, to look at how are we measuring the impacts for our children with SEND, and how are we all working towards these outcomes. We need to understand how we are making an impact for children and families, and we have got a new framework that we're working to, and this is going to be used to look at all of our commissioning across the borough. So what we need to understand is, how much did we do, how well did we do it, and what difference did it make? Now, we feel that we have too much monitoring and evaluation that we ask you to do, and want to simplify things, but we also want to know, how do organisations that we don't necessarily commission contribute to the output for Rochdale, contribute to our sense of place, and share some of the fantastic work that you're doing? Sometimes that might be with a view to further commissioning. Sometimes that might be with a view to us making that case at a GM level. But we need to work with you to think about, how do we capture that evidence moving forward? So here are our outcomes and some examples of the way in which we're collecting for SEND, but I will go in more detail on that in our meeting tomorrow. So a question back to you would be, how might you support us in gathering evidence across our system, and can you contribute to our evidence box, and what support might you need from us to do that? Another thing that we are launching is a SEND advice hub. So we know from listening to many parents over the years that getting advice for a child with special educational needs is a complex, multifaceted process, and often parents feel like they're banging their head against the brick wall trying to get that help. So we've listened, and we are working to test a new concept of a new Send Advice Hub blueprint. Now, this is being developed and there is opportunity for VCSE partners to contribute to this. But the view is that we will have a Send Advice Hub, but it'll be a hub and spoke model. So they will be able to access all the other advice that's out there. And there will be a callback service for parents, so that parents are not just going from door to door trying to get that support. We also want to host this within some of our neighbourhood family hub models, so that we are not just a phone line or an email address, because we know that for some people that can be frustrating, but that we'll be doing drop-ins in various places and at various sites. So I'd be interested in hearing from you on how you might connect with that work. This is another example of some work that we're doing. So you might have all heard about the Be Well survey. The Be Well survey was a survey done with secondary schools across Greater Manchester, and I think there were about 50,000 children contributed to that survey. And it was a questionnaire about well-being and emotional resilience and mental health. It asked children a number of questions. Now, the mapping from that exercise across Greater Manchester shows us that we're doing quite well in compared to some other areas across Greater Manchester, but it also showed us that there's a real divide within our borough. And interestingly, the Pennines area was an area where the outcomes were worse for children and young people around children's mental health. Now, that was quite a shock to me, because you would have ordinarily expected that deprivation would align with decrease in mental health and well-being, but that wasn't the case. So we have agreed to do a new test of concept in the Pennines neighbourhood. Now, this is hot off the press and it's being developed. But we know that whilst we've got mental health services and we invest well, we know that we've got our #Thrive service. We did some deep dive with an organisation called Aqua that found that that is still not easy to navigate for everybody, and that we've got some key components missing from that offer. So the key components that we've got missing from that offer from quite rigorous analysis are around co-production, and how we actively involve children, young people and families in designing our children's mental health services. Around workforce support, so how do we support that school or that professional working with a child with mental health needs? How do we offer training? How do we coordinate that? What is our trauma-informed approach? How do we work with grassroots organisations to train them to support children and families? Another theme was around parent support. Often children live within a family where a parent is struggling to manage the behaviours that they're exhibiting. So we know that sometimes when a child may be self-harming or in extreme distress, parents often feel very isolated in meeting the needs of the child. So we have invested in peer support. We're going to be developing a peer support model that will be borough-wide, but we'll focus in on the Pennines area as a test of change. The peer support workers will work with school health and some of our digital offers to ensure that we've got a rich offer for parents across Pennines area as a test of change, but then with a view to wider rollout. We know that often children and young people want to help themselves, and often they have to be referred to specialist services in order to get support. So we will be investing more in social prescribing. We'll be looking at things like our mindful movements offer to ensure that we are resilience building within our children and families. We will be unpicking what is going on in neighbourhoods or localities and what we can signpost children to with regards to early intervention. We'll be working with our public health colleagues to understand how we can align our resources, and we're supporting schools to implement self-help. There will also be a new Thrive Navigator role that will sit within that locality. And from a community asset building, I don't think we do well enough in children's with regards to community asset building. I am a firm believer in that we need bottom-up approaches that align with strategy so that we can work together to identify locality needs. So that is something that we need to develop, and we look to develop over the coming months. So community asset building. is this is Cormac Russell's model, and I'm sure some of you will be familiar with it, and if not, he's a good one to follow. So Cormac Russell describes community asset building as being done by the people for the people. We generally do things to people, we sit in rooms, we design strategies, we come up with solutions. I am changing that, and we are engaging more with parents and children and young people in doing things with people. So nothing for us without us. So we have a number of parents that sit on a number of our meetings. We have a parent chair of our SEND stakeholder forum, and for SEND we have co-designed from the very beginning, but we could do more and we want to do more. So that's just some other things that might be worth bearing in mind. And we'd like to learn from you how we can design our services from the bottom up and begin to embrace asset community-based capacity. And I'd really welcome your views on this, because as I said, it's a new area of development. So a number of things going on there. I guess we just have a discussion now around how some of you might want to be involved in any of those themes moving forward, and if you've got anything you'd like to ask of me, please do.